In this short video, I'm going to talk a little bit about how a peripheral neuropathy is treated. So in the first instance, if you are suffering from symptoms of a peripheral neuropathy, such as burning sensation in your feet or unsteadiness, or you've noticed that you've had a number of falls over the last number of months, you may present to your doctor with these symptoms. You'll then have a clinical examination and a clinical history will be taken, and your doctor will formulate a list of possible diagnoses. You'll then end up having probably a number of investigations. They'll largely be blood tests, so the most common being a test for diabetes or pre-diabetes and checking vitamin B12 levels, and there will be a number of other blood tests done. Then you'll probably be sent to someone like me to have a more formal diagnostic evaluation of your nerves. That test is called nerve conduction studies, and it's where we test the integrity of the nerves in the hands and feet to kind of further evaluate the nerves and to see if there is a diagnosis of a peripheral neuropathy, and if there is, what kind of peripheral neuropathy is present. So once you've gone through all that and you have received a diagnosis of a peripheral neuropathy, the next part is the treatment. So the treatment will take a number of forms. The most important will really be looking at the underlying cause of the neuropathy. So if you have been diagnosed as having pre-diabetes or diabetes, then management of that will be extremely important and will be the thing that will prevent further progression of the neuropathy. The next part of the treatment will be management of the symptoms. So if you have a lot of pain or burning, then that can be managed with neuropathic medications. Now this will be a discussion you'll have with your doctor. There's a number of different ones on the market. I think that they are modestly beneficial. So patients will often feel that they definitely make a difference to the symptoms, but in general, or not necessarily in general, like one of the limiting factors would be the side effects. Now, not everybody will get side effects from them, and I think they are certainly worth trying, especially if you are suffering from a lot of pain, because if they help and the side effects are not too bad or don't happen at all, then they can have a significantly positive impact upon quality of life. So the next part of the management would be exercise. So over the last number of years, there has been a lot of research looking at the value of exercise in the treatment of a peripheral neuropathy, and it has been shown to have a substantial impact upon the symptoms of a peripheral neuropathy. So I'm going to talk in another video in a bit more detail about the different components of exercise and their benefit for patients with a peripheral neuropathy, but really the exercise program should encompass all forms of exercise. So that would include some form of aerobic or endurance exercise. It might be brisk walking, jogging, running, tennis, swimming, that type of thing, whatever you're kind of comfortable with doing. Resistance training will form a hugely important component of the exercise program because it will help maintain your muscle strength and your bone strength. And then balance training will be of probably the most importance for reducing your risk of falls. So doing specific balance exercises is really, really important if you have been diagnosed with a peripheral neuropathy. The final component would be sensory motor training. And again, in another video, I'll explain in a little bit more detail what this entails. Although you can be assured that by doing balance training, you're already covering a lot of the sensory motor training. But again, it'll form an important component of your overall management of a peripheral neuropathy. So my advice, if you are diagnosed with a peripheral neuropathy, is to consider exercise as a really important component of your management and to try to encompass all forms of exercise on most days per week.